My name is Jess, and this is Patient POV. Um, Today we are talking to Caitlin, and this was a super exciting one to do because she is from the UK. So it was kind of a cool moment of recording with somebody from a different continent than I am in. And so that was really, really exciting. We got to speak with her about her conditions, which you'll hear about shortly, and how she's managing through it now. And so, just before we jump in, I'm trying to give a little bit of an update on me before jumping in. And so, last week, I mentioned that Journey, one of our dogs, was in the emergency vet. So, as a recap, she got spayed on Wednesday, and on the Friday, she got taken to emergency vet. She ended up having complete kidney failure, basically, or really bad kidney failure. And so she is now home again. She's completely fine now, but it was touch and go for a while there after 6 days in emergency vet getting fluids continuously. But she's a-okay now, which is absolutely what we want to hear. And so, yeah, that's the little update on the dogs. And Elda is my dog, and she is healing very, very well from the spay surgery. So that was also really great. So yeah, that was her craziness of this past week. Is just hoping that Journey would make it through, and she did, which is absolutely amazing. So, yeah, I'm so excited for you guys to listen in on this one. And this is Caitlin. Just a reminder to subscribe, and also anything that we ever talk about in the podcasts, whether it's recommendations, I typically try to put a link in the description if you want to just use that link when you purchase things off of Amazon. Helps me out a little bit as well. So that's really cool. Um, yeah, and you can either be listening to this through Spotify, Apple Podcast, and YouTube. So that's kind of cool as well that the three are set up. And then the last thing to mention was you guys can find me at Jess_and_Elda. And I am on Instagram in particular. So yeah, I hope you guys enjoy, and I hope you guys have a great week ahead. Thanks. Hello, hello. Very nice to meet you. Do you want to give an introduction on who you are and kind of what your background is?
Yeah, so my name's Caitlin. I live in the UK, and I have multiple chronic illnesses. My first one I was diagnosed with at 14, and most recently I've been diagnosed with hypermobile ehlers syndrome and functional neurological disorder. Um, I came from like a background of dancing and being really active to all of a sudden not being able to do those things. So it's been an adjustment, but yeah, I'm navigating my new normal at the minute.
Yeah, no, for sure. And then for anyone who doesn't know, do you want to just briefly explain what those conditions mean, or how they affect you?
Yeah, of course. So when I was 14, I started dancing quite a lot. I've danced since I was little, and I started to have a lot of pain in my hips. So I had various investigations done, and I had something called hip dysplasia in my right hip, which means the ball and the socket are not how they should be. So your joint is kind of catching on the socket. Um, and I was too young to have surgery at that point. So I kind of just muddled through life from being 14 to being 24 in chronic pain and not knowing why. And then most recently, I've been diagnosed with hypermobile ehlers-danlos syndrome, which is a genetic condition that affects basically all your soft tissue in your body. And there's a lot of things that kind of go hand in hand with that, and that are comorbidities of it. Um, and I've been diagnosed with functional neurological disorder, which is basically your body doesn't send messages to your nervous system correctly, and it results in various different seizures, and it can cause joint pain and paralysis and a lot of things that can't really be cured. You just have to learn how to manage it essentially. So that's happened in probably the last 2 months, my functional neurological disorder diagnosis. So still very new, and I'm still kind of learning how to deal with that. Yeah, but those are my main chronic illnesses at the minute. I am being kind of looked into for other things, but you never just have one, do you? You've got to have a list of them.
Yeah, no, for sure. Well, thank you for the context in which we will be kind of chatting about in your background. So a little fun question, I forgot to write it down originally, but a little fun question that I'm trying to ask all the guests that come on is there any shows or movies or books that you've been watching or reading that you're really into right now?
Yeah, so this may sound weird, but I have twin siblings who are 3 years old at the minute, and we've all kind of really got into watching Bluey. I don't know if you've heard of Bluey.
Yes, yes,
Yeah, well,
yes.
we're obsessed with Bluey in this house now. We just love it. It's such a wholesome, feel good family show. And they're only short clips, like 7 minutes each episode, but we love it. So we watch that on repeat in the house at the minute. Um, Gilmore Girls is something that I watch a lot. Always has my heart, especially at this time of year when it's like autumn, and it's just, yeah, Gilmore Girls is a real comfort show for me, which I watch all the time, probably about 10 times a year. I
Yeah.
love it. I repeat. Book wise, I've recently started getting back into reading. I kind of lost my interest in it, and I used to kind of fluctuate between reading and not reading. But I've been reading a lot of Colleen Hoover books at the moment. I don't know if you've heard of her.
Yeah.
She goes into depth about a lot of kind of controversial subjects, which I like. Um, yeah, so I've read a couple of her books. The most recent one I've read is Verity, and I definitely recommend Colleen Hoover. If you can, there is trigger warnings in some of the books, so obviously I would say read the front of them first in case. But yeah, Colleen Hoover's my new go-to for books at the minute.
That's awesome. Yeah, yeah. I was just recording an episode yesterday, I think it was, and they also said Gilmore Girls at this time of year. You have to watch Gilmore Girls.
How can you not? Best.
Yeah, for sure.
Honestly, I wish they were still filming them. I would love that.
Right? They did the what's it called? A year in the
Yeah.
life or something like that. And then they leave us on a cliffhanger and don't record again.
I know, I hated that. And I thought, oh, well, they must be bringing another one out, but they never have.
Yeah, yeah, it's such a disappointment.
I know.
Okay, awesome. Well, thank you for that. So I know you were mentioning that you were a dancer when you were 14 and
Yeah.
the transition between like 14 and 24 in particular. So how really has your life changed because of all these chronic conditions?
Quite massively, really. It happened quite slowly at first, and I've always lived with pain, so I just thought it was normal. Thought it's normal that I wake up every day in pain, and every activity I do causes me pain. I just thought that was normal until I was talking to my mum quite in depth about it, and she was like, "Caitlin, that's not normal. Like I don't wake up in pain every day. It's not normal for you to." Um, so I did really have to kind of fight for a diagnosis, which unfortunately is kind of the case with a lot of chronic illnesses. They find it hard to diagnose, or they don't want to diagnose, or they don't do the correct in-depth tests. So I think in the last 3 years my life has probably changed a lot more than previous, because I used to just mask my pain and try and fight through and try and live a normal life, so to speak, but I just couldn't do it anymore. And I know we've got a few questions obviously along the line about things that have changed and stuff, but obviously I've recently had to give up my job because I'm unable to work, which was quite an adjustment for me. um I'm very kind of goal driven, work driven mindset, so going from working full time, I used to manage people in an office setting, um to now being at home every day, it was quite an adjustment for me. But yeah, my mum is my full-time carer now, so I have to have her to help me out with a lot of things. I think you've just got to take it on the chin really and learn how to adapt your life to your new normal. And if I didn't kind of go with the flow, I'd probably let it consume me, which is not what you want. So I'm quite um I'm quite positive, to be honest, considering everything I've gone through, because I just think there's no point in dwelling on it because you'll just end up in a dark spiral. And you can't control it. So the things you can control, I think it's important to focus on them, like having a creative outlet or reading, like we were talking about earlier, and watching shows and stuff like that. Things that bring glimmers into your life rather than dwelling on the negative.
Yeah, no, for sure. You touched on so many good points there. So I'm going to try to remember to go back through
Yeah,
most of
sorry.
them. No, 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 it's amazing. Thank you so much. So why don't we go back to, you were mentioning you were having some issues getting diagnosed with
Yeah,
the doctors and the healthcare system. So I personally, again, am in Canada. So our healthcare systems are quite different. I
yeah.
record with a lot of people from the States as well. So what is the healthcare system in the UK specifically like, and how has that caused some challenges, or was it easy, or all that kind of stuff?
Um, I think because I was a young girl when I first tried to get my diagnoses and things like that, I got dismissed quite a lot by the NHS in England. That's what our health service is called, the NHS. Um, we have free healthcare, so we don't have to pay for our medical treatments. We don't have to get insurance and things like that that I think you do in Canada and the States. I'm not sure on that one. But our healthcare is free. Um, so I kind of got dismissed a lot when I was younger because they just thought, oh, it's another young girl complaining. It's probably just your hormones or your period or anxiety, and the usual things that they say. I'm sure it happens for a lot of people. But I really had to fight for a diagnosis, and I started to do my own research, to be honest, on things, because as I got older and my bones changed, and you still continue to grow until you're 21 as a woman. um a lot of things changed for me, so I thought, this is not just hip dysplasia, there's got to be something else. And I was driving myself insane with it, thinking, oh my gosh, nobody's listening to me. um my pain must be all in my head. And then I was doing some research. I started following different people on Instagram. I think that's been a real help for me. Having like-minded people with similar chronic illnesses expressing themselves online, and writing blogs and things. So I started to do my own research, and when I came across ehlers danlos syndrome, I thought that definitely sounds like I tick every box for it. So I kind of pushed for a diagnosis in that respect with the NHS, but the waiting list to see rheumatology, who is the department which would diagnose me, was 3 years. And I just thought, I can't wait 3 years. So luckily, my grandparents paid for me to go and see private chronic tissue disorder specialist, who was based in London. And he gave me my official diagnosis of Ehlers-Danlos syndrome, um, which kind of didn't seem real, to be honest, at first. I think, when you've been undiagnosed for so long and you just think it's something, it was quite hard to deal with at first, but also relieving to know that it wasn't all in my head. Um, so yeah, the NHS is hit and miss really. I'm on a lot of waiting lists for the comorbidities that come along with it. So I'm being tested for POTS, which is postural tachycardia syndrome. Um, but it's a 2.5 year wait to see the cardiologist. With my functional neurological disorder, I was in hospital after an 18-hour long seizure, which happened out of nowhere one day. I just woke up from a nap and started having like a convulsive, full tonic clonic seizure, and my muscles and all of my nervous system just didn't stop for 18 hours straight. Um, and when I was in hospital, they said, "Oh, maybe you've overdosed on the medication that you're taking, and this is a side effect." And they just kind of brushed me off and sent me home with nothing, still seizing. And then 2 days later, I went back into hospital, and a neurologist came to see me and then gave me the official diagnosis. And now I'm on a waiting list for another 2.5 years to see the neurologist. So I think, obviously, still since COVID, there's a massive backlog with patients waiting for appointments and referrals. And it is difficult, but I can't complain because my healthcare is free. So I think, I am lucky to not have to pay for my prescriptions, for example. I get those for free. All of my appointments are free. And I know people have to have insurance and have like quite difficult journeys with their insurance companies to be able to um, get the diagnosis or get their appointments or get their medications. So I am quite lucky to be able to get all that for free. Yeah. So it has its ups and its downs.
Yeah, no, for sure. So yeah, so like you were mentioning, the US is completely private,
Yeah.
with so you need insurance, of course, and then Canada, we are public, where like things are free. Medication isn't, but the actual like if you go to the ER, it's covered. And so understanding the wait times 100%. When I was getting my diagnosis, it was a few years as well. So that's interesting to hear that even in other countries that have these like public healthcare systems, there's still a huge wait time. So that's really interesting to hear. So when you go to the ER, how
Mhm.
long is it until, on average, or like right now, sort of thing? How long would it be for you to see a doctor? Like, is it a long wait time or?
Yeah, so if I was to go to the ER right now, not feeling great and waiting to be seen urgently, for example, it's about a 6 hour wait time, just sat in the ER until somebody comes out and sees you. Um, I'd probably say it's between 6 to 10 hours. I've been there 10 hours before, without even being seen. As soon as you go in, you'll get your standard testings done. So you like your blood pressure and your heart rate and things like that. And then you just sat in the waiting room for hours. So it's fluctuates between about 6 and 10 hours. And there's always a massive backlog, and they struggle with beds in the ER and things like that. So yeah, I'm sure it's probably the same with you guys or in the US. It's difficult. But you've just got to power through, haven't you? I know it's horrible sitting waiting, but you've got to fight for yourself. You've got to advocate for yourself, or no one else will. So I don't mind waiting if I know that I need to be seen there and then. But I am quite stubborn, so I
Yeah,
would probably 2 hours and be like, no, I'm not waiting any longer. I'll go home
yeah, no,
until I really need help.
yeah, no, for sure, for sure. So another thing that you had touched on previously is that you have your mom, and then you met some, or you've been on Instagram and kind of found a community through Instagram. So who would
Mhm.
you say is your support system, and how have they helped you, and how has that changed throughout your time?
My mum is massively my support system. I wouldn't be able to do half the things I could without her. Um, as of recently, she is my full-time caregiver because my disabilities fluctuate so much. I can't hire people. So over here, you can get carers who come in and out of your house and care for you at certain times of the day. I don't know if that's kind of similar in Canada or whatnot. But because my chronic illnesses are so like different and they fluctuate all the time, the care side of things isn't as flexible as it can be for me. So my mum took the decision to kind of take on being my primary caregiver. So she's definitely my biggest supporter. And I would say my family are my biggest support system, definitely. It was hard at first because it's very confusing for them to get their heads around, which it was for me as well, both diagnoses. But I kind of just helped them do a bit of research on it, I got some leaflets from different places, and, gave those to a lot of my friends and my family just so they could try and understand what I was going through a bit better. Not in a patronising way, but to kind of educate them on it as well, which they all found helpful. Obviously, my mum being my caregiver, she has to know what my triggers are and how to best care for me. So she's definitely my biggest support system, yeah. And in regards to the community that I found online, um, I did join a support group when I first found out about my EDS, um, and that kind of helped me understand myself a bit better at first. I don't go to the support group anymore because I don't feel like I need to, but it was nice to know that it was there at the start of my journey. Um, and I follow a lot of different people with a lot of different chronic illnesses, but I do feel like we all kind of get each other. Even though we may not have the same chronic illness, we still experience life differently to what people without chronic illnesses do. So I have a yeah, I follow quite a lot of different people with different chronic illnesses, and I find that interesting. And I do research on other chronic illnesses as well because I just find it so interesting the background of everything and how they can just happen out of nowhere, or you can be born with it and not know until you're older. Like some people don't get diagnoses until they're in their 40s and they've lived with it for their whole lives. So yeah, I find following different people really educating, and it's kind of not a comfort blanket, but it's comforting to know that you're not in it alone. So I think that's why I did take the step to be more open online about my chronic health, because I wanted to be that person that I needed at 14 to say, you're not alone, I'm going through this as well. It's not all in your head. So that's kind of what I was trying to do at first. But yeah,
Very nice.
support.
Yeah, yeah. Yeah, no, 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 for sure. Thank you so much. So then you were mentioning your mom's kind of helping you out through the day. So what would if you can even, I know some schedules are so different, but do you have like a typical day, what that would look like?
Yeah, so we have a routine now. At first, we didn't really, but I kind of live for structure and routine in my life. I'm one of those people that needs a good routine, and since coming out of work, obviously it was difficult, so I didn't have a routine. But we wake up at about 7 a.m. She brings me my breakfast and my morning medication. So I'll eat my breakfast, have my morning meds, and then we will go in the living room for a bit, put some TV on, watch the news in the morning, or sometimes we just listen to like relaxing music in the morning. Um, and the the kids kind of wake up at the same time, so they have their breakfast with us, and we'll probably watch Bluey for about an hour, and then she helps me have like a wash in the morning. So I'll clean my face, and if I've had a seizure kind of the day before, my mobility in my hands are quite poor. So she'll help me get dressed. She'll help clean me. Um, and then we just kind of relax really. Obviously I take my medication at different points of the day, which she knows as well, so she'll administer my afternoon meds, and then I've got like a mid to late afternoon medication and then a nighttime one. And in the evenings she'll help me get changed back into my pajamas. Sometimes I don't even get dressed, I just change out of different pajamas to cleaner pajamas, but at the minute I've tried to make myself get dressed into actual clothing more to give myself like a bit more of a structure to my day. But you know how it's sometimes it's too tiring. But that's what I've kind of been trying to do a bit more. Yeah, we don't really do much, to be honest, but it seems like I do a lot. What was I saying then? Yeah, we don't really have much to do in a day. If I have an appointment, she'll take me to and from my appointments. Um, she helps me use the toilet sometimes when my mobility is really bad. Um, we are currently waiting on a waiting list to get an adaptive home. So the house that we're in at the minute isn't very accessible for me or her. So it's quite difficult for us to navigate life around stairs, and the toilet's quite low, and we have like a bath with a shower, and it's not just a shower, if that makes sense. So
Yep.
climbing into the bath to use the shower is quite hard for me on some days. So we're currently waiting to get an adapted house, which obviously can take quite a while in the UK, but we're hoping that it comes through a bit quicker. So yeah, we just have set times for things and make sure we try and follow a bit of a structure, just to make it like we're having a normal day. So I can go back to what I was kind of used to when I was working.
Yeah, no, for sure. You just mentioned an adaptive home in the UK. Would that
Mhm.
mean you move into a new home or you just get things to make your current home more adaptive?
Both of those are an option, but at the minute, the property that I live in isn't able to really have adaptations done to it. So I've had an assessment from somebody who works in the council in the area that I live. So they've come and kind of assessed my house and deemed that even if they were to do adaptations to it, it still wouldn't be suitable. So I would move into a completely different home, which is already adapted. I struggle with stairs and the stairs at this property, and because I have seizures and things like that, it's unsafe for me to use a stair lift.
Mm.
So they were thinking about putting a stair lift in the property that I live in now, but because of a lot of my other different symptoms, they said that that wasn't safe. So we're kind of looking for a one level property that has an adapted bathroom, an adapted bedroom, because sometimes I might need to use my wheelchair in my house,
Mhm.
and my kind of halls and things like that aren't wide enough at the minute. So I'm on a list to be moved into an adapted house.
Yeah, that's really cool. And so how long is typically the wait time for the adaptive house?
Um, I had to really fight for it, but I've been put in kind of like an urgent band now. There's different bandings in the UK to kind of, which is how they choose who gets houses quicker. So I've been put into the highest band for my medical needs, um, and they're hoping to find me a house in the next 3 months. If they haven't found one in 3 months, we'll re-review the situation together, and then kind of take it from there. But it maximum 6 months is what the lady who I've been discussing it with in housing has said. So fingers crossed I get one in the next 3 months. If not, they'll still find me somewhere to be housed in 6 months. So it's not that long of a wait actually. Um, and I was surprised. I thought it would take way longer than that.
Yeah, no, for sure, for sure. Well, that's really cool. I definitely know that there's grants in Canada for
Mm,
creating a more adaptive house, but I haven't actually heard in Canada of adaptive housing like in
mm.
a new home. So that's really cool that you guys
Yeah,
have that. Yeah, for
it's
sure.
without it, it would make life a lot harder. So um, yeah, I'm quite grateful for that, and the fact that they can find you one in such a short amount of time, or adapt one that is able to be adapted for me to then move into. They'll do the adaptations for me already before I move into the property. So yeah, it is something that I don't hear a lot in other countries. So I am grateful to be able to have access to that over here, definitely.
Yeah, no, for sure, for sure. So previously you also mentioned that you try not to dwell on things and just stay positive. And from our conversation, you seem like quite a positive person, but how has your mental health been affected by all these chronic conditions? Because that can be a lot.
Yeah, it is a lot. At first, I really struggled. When I was younger, I struggled quite a lot with my mental health anyway. So I think the fact that I felt like I wasn't being listened to in regards to my pain and all of my symptoms, that kind of really did take its toll on me when I was younger. Um, I've learned to manage it a lot more now. I go to therapy and things like that for pain management, if that makes sense. So they do therapy over here for people who have chronic pain and chronic health conditions, where you kind of just talk about your conditions and how they're making you feel and how you can kind of change that negative emotion into something positive. Um, because sometimes you feel like your body's failing you, but if you really think about it, your body has done a lot for you to get you to the point to be able to actually still, like, even just us sitting here having a conversation now, um, I'm grateful for that, because some people can't do that. Some people don't have the use of, their mouths, or they don't have enough energy to be able to talk. So I'm definitely learning to be more positive. Don't get me wrong, I still have my bad days where I think, "Oh, I'm such a burden. My mum is kind of changing her life for me, and I make things difficult for other people." And you still do get these niggling little thoughts, but I kind of try to turn it into more of a positive thing than a negative. And I journal quite a lot as well as going to therapy. So I call it writing and releasing. So if I have like a negative thought, or if I'm feeling really down, I'll write it down in my journal, and then once it's on that paper, I release it, and I just don't think about it anymore. Which is something that I've been doing quite often when I'm feeling down. So writing and releasing is something that really helps with my mental health. So yeah, it's been a struggle to adapt to life because it's completely different, and obviously it's not how I ever envisioned my life going when I was younger. But these things are made to test us, and I'm a firm believer of that. Your path is always going to change, and it's never going to be how you envision it. You've just got to learn to adapt to your new normal, and it's not a negative thing. I'm still gonna be able to have a lot of life experiences, and I've learned a lot about different medical conditions, which is something that I could always go into in the future. So yeah, leaving work was something that really kind of impacted my mental health for a while. I really struggled with that, and I would say that's probably my biggest struggle I've had at the minute. Um, in regards to my diagnosis was leaving work because, as I mentioned before, I'm very kind of driven as a person. So I've got to try and find what my new purpose is, or like my new, I don't know, what kind of job I could do. Maybe I could start a business and things like that. Like that's what I've been thinking about. But I think channeling my energy into advocating online and raising awareness of my illnesses and stuff, that's kind of something that's helped with my mental health as well. Being able to talk to a community of people that kind of understand you a lot more than maybe your friends and your family do.
Yeah, no, for sure, for sure. That's awesome. And then another question would be just you've talked about a lot of these conditions and that you're trying to figure out what's working and what's not. And
Mhm.
so, is there any resources or things that you use that make your life just a little bit easier?
Yeah, so I use a walking stick every day.
Mhm.
Um, I started using mobility aids probably about 2 years ago now. Um, when I was really struggling with my mobility, and I thought, this is going to change my life, so I can't be ashamed about using it. And I kind of got into it very quickly. I wasn't ashamed of myself. I wasn't embarrassed to use it out in public because it really gave me a new lease of life. So I use a walking stick. I do have a wheelchair. It's not a self-propel one. It's one that someone has to push for me. I don't have the strength in my arms to use a self-propel wheelchair yet, but I'm hoping one day I will be able to build my strength back up to use one. But if I'm going on like walks or things like that, or um, if I'm going outdoors with my friends and my family, I tend to go in my wheelchair to do that. So mobility aids have changed my life completely. And if it ever crosses your mind that you may need one, I would suggest just try it. What's the worst that can happen? Um, Luckily over here, the NHS do supply different types of mobility aids. So I did get a walking stick from the NHS. Um, and I have kind of bought my own along the lines, but luckily that was kind of given to me at first. So I know that they can be expensive to fund and things like that, especially wheelchairs. They're very expensive. So um, I haven't got like the best brand wheelchair, but it still helps me day to day. I use a lot of like ice compressions
Hmm.
and ice packs. I've got this big cap that covers my eyes. It's called like a migraine cap. And then I sleep with that every night because it's just so cooling, and it kind of takes some pressure off my head because I do get quite bad migraines. Um, I use a knee strap because of my ehlers danlos. I can sublux different joints, so I use quite a lot of things like that. So I've got a knee strap, a wrist strap, like an ankle wrap, and things like that. Kind of just make my day that little bit easier. Um, and I have like a special pillow that I use to sleep at night, which helps align my hips in the right place. In regards to kind of like podcasts and things like that, I would say I'm more of a website person. So Earl's Danlos have a website for the UK side of it, and it's called EDS UK. And that has a lot of information on it, and that's where I joined the support group through them at first, because they have them in all different areas, the virtual online ones, but they kind of just advertise them in different areas. So the one that was in my area, I joined for quite a while, um, and there's an app for my FND, and it's called FND, the app, and you can log your seizures and your symptoms and things like that, and it helps kind of try and find patterns in regards to um my health on that side of my chronic illness. So yeah, I would say I tend to just do my research myself, and that helps me um understand it. I'm very kind of a visual person. I do like reading. So I did a lot of studying in regards to my chronic illnesses myself, which has helped me be able to talk about them more and helped me help others understand it more, if that makes sense. So yeah, I haven't. I haven't found a podcast yet, but I would like to. I love listening to podcasts, but I haven't found one that kind of covers what I would like to hear about.
Mhm.
Like the one we're doing, for example, I would listen to this, but I haven't kind of heard of any others that talk about chronic illness and things like that. So that was something I'm still looking into.
Well, that's what we're trying to do here. Create
Yeah,
something for the for what we're
exactly.
looking for, really. Yeah, yeah, exactly. So, thank you so much for coming on today. I really do appreciate you taking the time and chatting with me. So I really do appreciate it.
My pleasure. Thank you for having me.